I came up to PCHC after doing a 5-week externship during my 4th year of dental school. I had a very good experience here while I was here. I got to do a lot of operative, a lot of extractions, and I got to see what the residency was really about before applying. And after that, I decided to apply and luckily got a position here. I knew that the residents got to do a lot of endodontics, a lot of oral surgery. We have specialists that come in generally once a month from each of the specialists. For instance, today we have Dr. Pfister, an oral surgeon. He's going to be here 3 days this week, helping us do more complicated extractions. Done a lot of impacted third molars, various other impacted teeth, along with more complicated things like apicoectomies, implant placement. We have all the different specialists that come in and help us out. That's a lot of fun.
All right, so we're doing an apicoectomy and cyst removal on number 10. It's basically just a root end surgery, backfilling the root canal after the root canal's been done previously. Now we're going and doing the root end surgery for it.
Anybody want to see this? We only use the back end. We use it back end. We use it soft tissue. You take the tissue in the back end. Come out to it. And in the process of working with that lady and having drinking on the job, which is unbelievable to me, he got his arm caught in the lathe. And he essentially took his arm right off. But in addition to catching his arm on the lathe, he caught his mandible on the lathe as well. And he completely disjoined his mandible from the rest of his cranium. They laid him back, and when they go to lay him back, his mandible came back off of his chest, okay? And now he had an acute airway obstruction, so he wasn't able to breathe. Well, I was there in the ER at the time, so I simply grabbed his mandible and pulled his mandible forward, and you can't imagine the sound of the air going in. All of a sudden, and then the guy woke up again.
This dental facility is probably the biggest northeast of Boston. So we see a lot of patients and a lot of people need care here. So definitely a good place to begin your dental career. Facility-wise, I got to see a laser once in school, but here I can often use it whenever I want it. And I like the experience, the cone beam CT. Whenever I have a patient with that I'm treatment planning an implant for, I get to use it. Whenever I'm doing root canals that are tough, that I may think I miss a canal, I can definitely take a CT, and it's fun doing that.
I love having an assistant, especially coming from school when you didn't have one. It's really nice because it gets you used to going out into practice with your own assistant. They know what you like, you know, you can communicate with them easily. It saves time to have your own assistant. You don't have to worry about things getting set up the wrong way, and they always can anticipate what you like, so it's definitely nice.